This is your step-by-step guide on how to administer the CareStart COVID-19 Rapid Antigen Test. Please comply with the latest Therapeutic Goods Administration (TGA) conditions for the use of the Rapid Antigen Test as advised by Pantonic Health. The CareStart COVID-19 Rapid Antigen Test Kit includes one Instructions for Use document. In each kit of 20 tests, you will find 2 control swabs, one positive marked with a red label and one negative. The 2 control swabs can be used for quality assurance. For each individual test, you will need the following: a test device, a sterile anterior nasal swab, an extraction vial, and an extraction vial cap. The medical or health practitioner will put on the required personal protective equipment, PPE. This includes a medical-grade face mask, a medical robe, and a face shield. Thoroughly wash or sanitize your hands before putting on a new pair of medical gloves. Instruct the patient to thoroughly wash or sanitize their hands. Remove the test device from its packaging, placing it on a clean, flat surface. Locate the nasal swab and carefully remove it from its packaging, ensuring not to touch the swab tip. Gently insert the swab 2 to 3 centimetres into the patient's nostril. Slowly rotate the swab at least 5 times in a circular path over the surface of the nostril for a total of 15 seconds. Using the same swab, repeat this collection process on the patient's other nostril, also for a total of 15 seconds. Locate the extraction vial and gently peel off the aluminium foil seal. Carefully place the swab into the extraction vial and rotate the swab vigorously at least 5 times. Remove the swab by rotating against the extraction vial, while squeezing the sides of the vial to release the liquid from the swab. The swab can now be discarded into a medical waste bin. Close the vial by firmly pushing in the cap provided. Thoroughly mix the vial by swirling and flicking the bottom of the tube. Invert the extraction vial and hold the sample vertically above the sample well on the test device. Squeeze the vial gently and allow 3 drops of sample to fall into the sample well. Carefully place the test device onto a clean, flat surface. The vial can now be discarded. Start a timer for 10 minutes. It is important that the test device is not moved or lifted during this time. After 10 minutes, read the result. The test results should not be read before 10 minutes or after 15 minutes. COVID-19 positive. A positive result shows 2 lines, a red line at C, a blue line at T. Any faint coloured line in the test region should be considered as positive. COVID-19 negative. A negative result shows 1 red line next to the C. If the red line is not visible, the result is invalid. Another test will be required. In the case of a positive result, you must immediately 1. Undergo a laboratory-based PCR test. 2. Contact your local public health unit and follow their instructions. 3. Self-isolate until you receive a negative PCR test result or as instructed. All testing components, including the test device, should now be disposed of in an appropriate hazardous waste bin. The practitioner should then remove PPE, performing hand hygiene between each step, as per Department of Health recommendations.